Hi YouTube subscribers, hi YouTube world. I did want to make a follow-up for those of you who might have seen my other videos about the Nclex. So I did finally get my results and I passed. So I can say now I'm a registered nurse, which feels really good to say after a long time of working my butt off in school and studying all the time. So yeah, so it took me 3 days to get my results, which was terrible, but I think it was just because I took it on a Saturday. Usually it only takes 1 to 2 days, but because I took it on a Saturday, I didn't find out till Tuesday, and the waiting, I think, is actually probably worse than the actual test. As you might have seen from my videos where I was complaining and stuff about how torturous it is, not knowing if you've passed or failed. Mine shut off at 79, so all I knew was I either did really good or I did really bad, because the soonest it can shut off is at 75, and that means one of two things: either you've completely failed all the questions, like you haven't done well, or you did really good. Otherwise, the test just continues. You might be borderline if it keeps going. So anyway, yeah, I'm happy to report that I passed. I did apply to a job yesterday. I worked on my resume, so I've been really busy. So that's why I haven't made a video till now. I didn't use UWorld, but I would recommend, if you have the money, to purchase UWorld. I've heard from a lot of people that it's really helpful, that the test is very similar to that. If you're on a budget like I was and you don't have money or you don't want to buy UWorld, then I recommend studying the subjects that you're weak on or that you've forgotten, to go back and revisit them, but you probably don't have time to look through all your notes, and it's just too much information to look over everything. So I recommend just looking at stuff you struggled with or forgot about. That's what I did. And then I made flashcards, because I'm a very visual person, so that helped me a lot, making flashcards on diseases that were very similar but confused me, because I had to know how they were different exactly. For instance, knowing the difference between Addison's and Cushing's, I made flashcards for that, and other diseases that were similar but different in a lot of ways. What else did I do? Oh, I read the Kaplan Nclex book for 2015 to 2016. That was very helpful. What I liked the best about that book is it gave you strategies for approaching questions. Instead of just doing a million questions and never getting like the pattern, I thought this was very helpful in that sense. It talked about different strategies to tackle questions overall, like obviously using your ABCs, going through Maslow's hierarchy, also depending on the question, you can rule out pain a lot of times as an answer, depending on the scenario and the question. Things like that. Those tips I thought were so helpful. And I did it also had a practice test with 265 questions with all the rationales. Again, super helpful. It doesn't really help you if you're doing a ton of questions and you're not seeing patterns and you're not reading rationales, because you really have to understand the thought process behind it so you can critically think when you take the Nclex. So I read through that whole book. I also had a Nclex, can't talk. I also had a Med-Surg Nclex book that my mom had purchased for me. It was a thin book, but went over all the major diseases that you should know for the Nclex. And let me grab that book, because some of you might want to know Oh, actually, I can't grab that book. I lent it to a friend who hasn't taken the Nclex yet. But I'll get back to you guys on what that book was called. But I thought that was a good place to start because it was a good overview of all the main like diseases and nursing interventions that you should know about, because when you first start studying for the Nclex, it's kind of overwhelming because there's so much content. But that was a good book to go over everything and see what, like, oh, I need to revisit kidney stuff, or I need to revisit this section. That book, I think, was good at doing that and seeing what you need to revisit and what you already know, and a good refresher. Yeah, so those were the two main books. I did do some Quizlet quizzes online that dealt with prioritization, because one of my friends said that that was something important to know for the Nclex, and it is. And that's something I kind of struggled with. So I did a bunch of Quizlet quizzes, maybe like 3 or so, with a bunch of questions in each one, and went over the rationale. Again, the rationales for these questions are sometimes even more important than answering the question a lot of the time. I did get, my friend gave me her UWorld password towards the end, like a couple days before I took the Nclex, but because it was only a couple days before, I really didn't have time to use it a lot, but it was helpful in the fact that I saw what the computer screen would look like during the test. So, one less thing that's kind of unfamiliar that I didn't have to worry about taking the test. Like, I knew what the screen would look like and what I would need to click on, which it goes over. There's a tutorial in the beginning of when you take the Nclex, but it just makes you feel, I think, a little more confident if you already know what the format is going to look like. So I did that. I tried to do one of her 75 question tests that she had purchased, but it had her answers already in it. So that wasn't, I think, super helpful, because it's not helpful when you're doing questions you already know the answer to. Like, you want to think it out and see if your thought process is correct. So that's why I didn't really use UWorld a lot. But I did get the idea of what the questions were like, and I thought they were kind of similar to Quizlet quizzes that you can find online for free, but maybe just a little more similar to the Nclex, a little bit better. So that's why I recommend if you purchase UWorld if you can. But if you can't, like me, I was able to pass it without, and I did just fine. So don't think you're going to fail necessarily just because you don't purchase UWorld. And then, I did go over a HESI book. I will show you guys that because I do have that. So my school gave us like a HESI review. Once we graduated, it was free. Well, we didn't have to pay anything extra. It was included in our tuition. It wasn't free, but you know what I mean. Okay. So anyways, I thought this book was also very helpful. Okay. This book is the HESI Nclex RN exam book for 2018 to 2019. And I thought this book was great as far as a great overview and refresher, again, of like all the content that could be covered in your Nclex exam. And it has questions, which we had already done the questions in class, but I went back over to see if I was getting better at answering the questions since I had reviewed content and everything. And I think and gotten strategies from the Kaplan book. So I think I did do a little bit better with the questions in here. And I just went back over like content, and I highlighted a lot of stuff. For me, that's a good way for me to memorize things, is actually writing notes in this book and highlighting stuff that I want to remember. For some reason, that implants it into my brain better. If you're somebody like me who likes to take notes during lecture and that helps you memorize things, then take a lot of notes in Nclex books and highlight stuff. And you can use different highlighters too to help you remember. And yeah, so that's mostly what I did to study for the Nclex. I didn't even make it all the way through the book, but I made mostly all the way through, and I really just made sure I understood content inside and out, because the Nclex is a lot of critical thinking, so it's not going to be a memorization. You have to really understand the pathophysiology of a lot of diseases. So that the other thing I did to help understand patho and more in depth with diseases is I did go on YouTube and watch some of, can't remember her YouTube channel name, but she's like a Southern nurse, and it's like rnnursing.com or something. I'm sorry guys, I can't remember, but if you're in nursing school, you probably know who I'm talking about. The lady with the thick Southern accent. She's got a bunch of YouTube videos. They're awesome. Check them out. So I watched some of her videos on diseases that were still confusing me a little bit, that were very similar, like Cushing and Addison's, I believe, were the videos I watched of hers, and a couple other ones. And then I YouTubed some other diseases that were confusing me still or whatnot. But yeah, you really need to know. I focused more on content than doing questions, because I feel like if you really know the diseases and what your role is as a nurse, then you can be asked any question and you'll be able to answer it in a thoughtful manner, which is what the Nclex wants to see. It wants to see that you're a safe nurse and that you think things through. So definitely take your time when you're answering questions. It only took me an hour and like 40 minutes to finish. And that was even with me slowing down. And I recommend you slow yourself down during the test. You don't want to get hung up on a question that you don't understand necessarily, because it could just be a question that's like, doesn't even really count. Like, how do I explain this well? They have certain questions that are just pilot questions is the word I'm looking for. They have pilot questions that they're just testing out on anybody to see if they're even good questions, that I believe don't even really count towards your grade. But that's what I tried to tell myself, because the HESI review lady told us that, like, don't get hung up on a question because it might just be a pilot question. So you don't want to spend more than like 5 minutes on a question. If you can't figure it out, just use your best guess and move forward if you've thought about it and everything for a couple minutes. And you can't go back with questions during the Nclex, so know that once you put in a question, an answer, you can't go back. So that's why you do want to take your time and make sure you're thinking out every answer, what would happen if you were to do them. Yeah, and I feel like in general the Nclex is a kind of broad test, because they want to make sure in any kind of scenario that you would be a safe nurse overall, because they only have so many questions to determine if you would be a safe nurse or not. They kind of draw from a lot of different areas, so I think you really need to study like everything if you can't purchase UWorld. By everything I mean know the basics of the main disease processes, know pediatrics, you have to know OB, you have to know a little bit of everything, the main concepts. So that's why I focus more on content than doing a million questions, although I did do those as well. Yeah, I feel like it's a very broad general questions that they ask, not very specific, so there's no way you can like memorize all these medications and go in and just pass off of that. Like, you have to understand the thought process and do critical thinking. It's not a memorization test, and that's why I feel like you really do need to know all your content, at least like the main important things. Yeah. And there's no way you're going to be able to memorize every medication that's out there, so I wouldn't focus on necessarily doing that, but know your beta blockers are going to end in OLOL. Like, you're not going to be able to memorize every name of every drug, but know, like, this ends in this, that means it's in this drug class. At least have that idea. Like, if it has barb in it, it's probably a barbiturate, that sort of thing. Or if it's an ACE inhibitor, it's going to have pril at the end. And know, like, the main heart dysrhythmias, know the steps in CPR, know the steps and basic skills that you were taught in nursing school, like what are the steps to insert a Foley catheter, what order would they be in, that sort of thing. And there's all kinds of different modalities to the questions as well. So if you're not good at select all that applies, know that there will be plenty of those on the test. So practice those either with UWorld or online or with Nclex books. Okay, anyways, so those are my main tips, and just letting you guys know that I did pass, and I did apply to a job yesterday. I gotta keep doing that, and hopefully I'll get hired soon. Yeah, so I'll make a follow-up soon, hopefully updating you guys on my job situation. But anyways, if you like this video, give it a thumbs up, and please leave comments, and don't forget to subscribe. My other main tip I was just thinking of a couple more things. The day of the Nclex, don't do anything very stressful. You want to go in there positive with a calm attitude. So eat breakfast, go to bed early. That's what I did. Maybe do some meditation or like a little bit of yoga. And then during the test, just keep giving yourself that positive self-pep talk. After 75 questions, if you're still going, it can be a little bit nerve-wracking, but just keep a positive attitude, because it might shut off soon. It might not, but you have to keep going. Just keep going, just like you did with nursing school, and you'll be fine. And think to yourself that you'll pass. And when you're waiting for the results, try to keep a positive attitude, and I recommend just getting your mind off of nursing for those few days, because when I was looking up, Googling stories of people who failed the Nclex and what their scores were, it just made me feel like crap. So please do yourself the favor and don't do that. Okay guys, well, anyway, stay tuned, and I'll catch you later. Bye.